Today I'll be talking about a condition called endometriosis. Endometriosis is a very commonly encountered gynecological condition. The prevalence is around 2 to 10% in the general female population, and it could be as high as 50% in women who suffer from subfertility. So the way we describe endometriosis is that it's a chronic inflammatory condition wherein endometrium, which is the lining of the womb, lies outside the womb, and it could be present on the tubes, ovaries, or onto the tummy or the pelvic side wall. The symptoms of endometriosis could be painful periods, which is one of the commonly encountered symptoms women present with. The other symptoms could be painful vaginal intercourse with a deep-seated pain and noticed in the lower tummy. Women could suffer from a chronic dull ache that is present all throughout the month. The other symptoms could be general symptoms such as symptoms of fatigue or bowel changes or water changes at the time of periods, wherein women can have bleeding from the back passage during their periods. They could be constipated, or they could suffer from loose stool. They could also suffer from painful passage of urine or bleeding in the urine. It's difficult to say as to what exactly is the cause of endometriosis, because there have been various theories that have been provided in the literature, and the common ones that we encounter are a genetic predisposition wherein endometriosis runs in the women in the family. It could be iatrogenic, i.e. after a cesarean section around the scar, or it could be because of what we call as retrograde menstruation, wherein the lining of the womb that sheds every month, some part of it for some reason travels through the tubes and deposits on the wall of the womb outside, or on the pelvic side wall, that is the lower tummy side wall, or onto the ovaries. Majority of the times endometriosis is a condition of women in the reproductive age group, but this could also linger towards the perimenopause and can be found in menopausal women as well. A good history taking with bimanual pelvic examination is usually enough to initiate the treatment of endometriosis, i.e. the initial treatment. There are times we would investigate this further, performing a transvaginal ultrasound scan, an MRI pelvis, or a laparoscopy, which is a keyhole procedure. So the treatment of endometriosis is both medical and surgical treatment, and in common practice we start with the medical treatment, which is less invasive. The commonly used treatments are a combined pill, a mini pill, a Mirena coil, which is usually considered as the first line of treatment. It is a progesterone coil. The other treatments could be GnRH injections or certain tablets such as Reco tablets. And the surgical treatment could be a laparoscopic treatment, which is a keyhole treatment, wherein the endometriosis could be surgically excised or ablated. So if you do encounter such symptoms, I would recommend for you to see a gynecologist. Thank you.